There are many conditions that may mimic a basal cell carcinoma, and most of them can only be diagnosed with confidence only after an excision biopsy. However, we shall consider the characteristic features of some of the important ones and mention a couple of points for the others. Unlike a basal cell carcinoma, sebaceous gland carcinomas are more common in women. The characteristic features of a sebaceous gland carcinoma are: the lesion is higher than the level of the tarsus, the lesion is more visible on the tarsal conjunctiva, widening of the lid margin, loss of meibomian gland orifices over the lesion, rounding of the posterior lid margin, marginal telangiectasia, loss of eyelashes. The lesion is slow growing and typically yellow in appearance due to the presence of lipid. Ulceration is uncommon. In contrast to a basal cell carcinoma, a squamous cell carcinoma occurs more often in the upper eyelid. They are more prominent on the skin side. They have indurated margins. They are not as flat as basal cell carcinomas and tend to ulcerate more aggressively. As they are rapidly growing, secondary pigmentation does not usually occur. The presence of nearby actinic keratosis may provide a clue to the squamous nature of the lesion, and these carcinomas often invade the orbit and regional lymph nodes. Keratoacanthoma is nowadays considered to be a variant of a squamous cell carcinoma. It has a smooth lobulated appearance and is characterized by the central keratin-filled crater, which occurs as a result of its rapid growth that outgrows its blood supply. This, along with the elevated rolled margins, is what makes it sometimes resemble a basal cell carcinoma. A keratoacanthoma may regress spontaneously because of the necrosis. A primary malignant melanoma of the eyelid occurs almost exclusively in Caucasians. Clinically, a melanoma appears as a variably pigmented mass with irregular borders that can bleed or ulcerate. It can mimic a pigmented basal cell carcinoma. Now, let's see about some less common conditions. We've already talked about keratoacanthoma, so we shall see about these first three. Seborrheic keratosis may occur as a single or as multiple lesions. The lesions are slow growing, appear as hyperpigmented tan to brown plaques that are discrete and movable and appear to be stuck on the skin like a button. The surface is rough with discrete fissures. Inverted follicular keratosis is a benign cutaneous lesion that occurs more commonly in middle-aged to elderly males. It appears as a discrete, nodular, wart-like lesion. Pseudoepitheliomatous hyperplasia usually occurs as a nodular, irregular, crusted lesion which is difficult to clinically differentiate from a basal cell carcinoma. However, in contrast to a BCC, it is a rapidly growing lesion. Now we shall see some sweat gland tumors that can sometimes mimic a basal cell carcinoma. Syringomas are common, benign, small, multiple tumors in young women. However, when they are solitary and large, they can simulate a basal cell carcinoma. Syringocystadenoma papilliferum is an uncommon benign tumor that arises from apocrine glands. Only about 25% arise in adulthood. They are plaque-like in the early stages, which often become elevated with a verrucous or papillomatous surface. Central umbilication simulating a basal cell carcinoma may occur, and it is believed that occasionally the lesion can evolve into a basal cell carcinoma. An ecrine acrospiroma, when large, can be blue, crusty and ulcerated and resemble a basal cell carcinoma. Pleomorphic adenoma from sweat glands is rare, but a solitary lobulated lesion can mimic a BCC, as can a nodular and ulcerated adenocarcinoma. Hair follicle tumors can also mimic a basal cell carcinoma. Trichofolliculoma is dome-shaped, and is a skin-colored nodule. It appears at the eyelid margin with a characteristic central pore through which fine hairs and intermittently sebum protrude. A trichoadenoma is a rare tumor of hair follicle differentiation. It usually resembles a basal cell carcinoma. Trichoepithelioma is a benign tumor of early adulthood and appears as a skin-colored dome-shaped papule. A larger lesion has telangiectatic blood vessels that can lead to confusion with BCC. However, unlike a BCC, it is relatively stationary and rarely ulcerates. A tricholemoma is a verrucous or papillomatous nodule that is usually diagnosed initially as a BCC. Some other rare lesions that can simulate a basal cell carcinoma are schwannoma, Merkel cell carcinoma, melanocytic non-pigmented nevus, eccrine hydrocystoma, and apocrine hydrocystoma. So that's it for today.